Hello and welcome to a series of podcasts called Children's Palliative Care Voices from Together for Short Lives, the leading UK charity that, together with our members, speaks out for children and young people who are expected to have short lives. Our first podcasts are recordings of oral evidence sessions held by the All-Party Parliamentary Group for Children who need palliative care. The All-Party Group, or APPG for short, is a group of MPs and peers at Westminster with a specific interest in improving the quality of life and quality of end-of-life care for the 49,000 babies, children and young people in the UK who have life-limiting or life-threatening conditions. During 2017 and 2018, Together for Short Lives is supporting the APPG to conduct an inquiry into the extent to which the UK government's end-of-life care choice commitment is being met for children in England. The oral evidence session is part of that inquiry. During our first podcast, you can hear the APPG's co-chairs, the MPs Catherine McKinnell and Dr Caroline Johnson, hear evidence from Lucy Watts, MBE, a young woman who has a life-limiting condition. This evidence session is one of several which the APPG is holding as part of its inquiry, all of which Together for Short Lives will issue as subsequent podcasts. If you'd like to know more about Together for Short Lives, or how you can support our vital work, please visit our website at www.togetherforshortlives.org.uk. Let's join Catherine McKinnell MP as she introduces the session.
Thank you so much for being here, and thanks also for all the panel and the witnesses for being here as well. And I thought maybe if, I'll introduce myself. I'm Catherine McKinnell. I'm the MP for Newcastle North and the co-chair of this All-Party Parliamentary Group. And
hi, I'm Dr Caroline Johnson. I'm the other co-chair of this parliamentary group and also a consultant paediatrician.
And if you would like to introduce yourself, Lucy, shall we start there?
So I'm Lucy Watts, MBE, I'm 24 and I have a life-limiting condition, and Molly sits beside me, my assistant's dog.
And are you happy if we just sort of get started, and then obviously we'll when is it Junior?
Junior, yeah.
To be referred to?
Junior.
When Junior arrives, we can kind of break and do a little introduction as well. And also, I have already explained that I will be leaving, so don't think I'm rude when I sneak out. That's just something that's happened this morning. So, Lucy, I don't know if you want to just say something, if you've got anything you particularly want to say, or if you're happy for me just to ask specific questions.
I don't mind either way.
If we start with, have professionals, do you feel that they've had honest discussions with you about your condition, the fact that it's life-limiting or life-threatening, and how well do you feel those conversations have been conducted?
So initially we didn't realise my condition was going to shorten my lifespan, and I think for a long time people kind of skirted around that conversation, and it came to a head, and they kind of sat me down, and my consultant sat me down, he sat on the bed next to me in the hospital, and he just told me, but in a very compassionate way, and he did explain it in a lot of detail. He talked to my mum as well, obviously my mum's heavily involved, but also my hospice nurse from the Jay's Hospice. She has had so many honest conversations with me over the years. There's no kind of things off limits, so she doesn't lead the conversation, she doesn't really lead the conversation, she just kind of guides it. So we've always had very open and honest discussions, and I think that's reflected with all of our professionals. We are open and honest on both sides.
And when you said we didn't realise to start with, was that the professionals with the condition that you have didn't realise that it was going to be life-limiting, or that you and your family didn't realise, but the professionals knew?
So basically I was born without health. I had health problems, but they went undiagnosed through my childhood, so I didn't, I got on with life despite everything that was going on, and I got to the age of 14 and became disabled, and I got diagnosed with a condition called Ehlers-Danlos, which is not life-limiting, it's not life-threatening, and it's not progressive. But my condition has always progressed, and it will shorten my lifespan, and that's when we realised there was something else going on, and that's when they kind of sat me down and said, look, we don't actually expect you to live another 5 years, but I'm still here. But I think that conversation, it sounds like a very bold statement to say, but actually it was done in such a way that he was kind of saying to us, it is going to shorten Lucy's lifespan, it is going to get worse. And my mum kind of said, well, how long have we got? And he said, I wouldn't expect you to see 5 years. But it was just the way he said it. he was so supportive. It was just, he spent a lot of time with us, just talking to us, just spending that time with us, letting us talk. And actually I think that was a lot better, because a lot of consultants come in, they give a diagnosis, they walk out, whereas he actually spent that time answering our questions, going through everything, and that was really powerful. And same with my hospice nurse, she's always been upfront and honest with me. You know, she's had conversations where we thought my life's going to end at any time. We've had conversations where, you know, I think there's a treatment or something that might help, and actually we find out it's not, and she's always been there. So those conversations are always very compassionate and very kind, but they're always very honest, and I think I value honesty above anything else. I'd rather know what I was dealing with than someone say something to make me feel better. I'd just like sooner know the worst case scenario and be able to deal with that.
So have you been supported to develop like a personalised care plan as well? Based on what your preferences and how you want to be looked after?
Yeah, so the hospice have done a lot of conversations. I've had care plans from like social services and continuing healthcare, but the more holistic care plan came from the hospice. And we had a very in-depth conversation. We talked about, you know, where I wanted to be, what I wanted done, what I would and wouldn't want to happen. So I haven't actually put anything in place yet because I haven't made that decision. But those discussions are down on paper. They know what my wishes are, they know where I want to be, they know where I want to be cared for, they know who I want to be cared for by. And actually those conversations and that care plan are very reflective of me. And actually what we did is she wrote everything down for me and then sent the care plan to me to read through so that I could make sure it was my words. So it wasn't just that she listened to me and wrote it down, she then sent it to me so that I could check back and kind of go through it and make sure it was exactly what I wanted it to be.
So is this your care plan now and on a continuing basis, or have you also discussed end-of-life care plan and what you want to happen and how you want that to happen? Is that something you've discussed as well?
Yes.
I mean, you said you haven't quite decided. Is that where you're at?
So basically I've got the generalised care plan that's got kind of a statement of my life as it is now, but the end-of-life planning, I've got my preferred priorities of care, so where I want to be cared for and who by, and then I've got preferred place of death, so if I do come to the end of my life, where I want to be. I am on the local end-of-life register, so that if anything does suddenly deteriorate, it's flagged up. But we've got kind of the generalised care plan that kind of changes over time, and then we've got this end-of-life plan that's, I think it's been changed a couple of times, but actually, although I haven't made an advance directive and decided that actually I don't want this or I don't want that, actually my wishes and where I want to be and who I want to be cared for are written down.
And does that make a big difference for you that is in place?
It does, it's peace of mind more than anything. I know that wherever I go, whatever I do, you know, if we phone an ambulance and it's a life-threatening situation and perhaps I don't want to be in hospital, we've got this document to show them. If, you know, I go to do a consultation or something like that, I've got a care plan to refer back to that actually says, you know, this is what I want, this is where I want to be, this is who I want to be cared by. And actually that's really important, and I think it comes back to peace of mind. I know that whatever happens, that care plan is there, so everyone will know my wishes.
Do you think they're respected in terms of your needs and your wishes, and respected and reflected in the care that you receive in practice?
Yes, I mean we have had to fight for a lot of care packages and things like that, so it has been a battle, but in terms of actually having the care plan, it's really useful because it's all in one place, and actually you can share the same care plan to any professional you encounter. You can send it to, you know, a continuing healthcare team or social services or a consultant, or if I'm going to be admitted to hospital, you can send it to them. So actually, it's kind of like everyone knows where they stand. I have had to fight for my wishes. I won't deny that. We have had to fight at times, and there's been times when they've wanted to put me in hospital, I've not wanted to be there. But actually, we've always been able to come to a mutual agreement. For example, if I need IV antibiotics, if I can stay at home, we'll have them at home. So actually I'm home rather than hospital, and it's actually, I think it's more of a conversation starter. So I can actually say, look, these are my wishes, what can we do? And then together we can actually work out a reasonable agreement on both terms.
Can I ask how old you are?
I'm 24.
Do you think now you're an adult that's become easier because you're able to have more autonomy over what you would like to have than you were as a child?
I think so. I think it's probably easier because I can speak for myself, because I can make my own decisions, whereas obviously as a child my mum was making my decisions. And actually, you know, transition to adulthood was a horrendous time for me. You know, it was horrible, but actually it's given me a lot, and it's given me that autonomy. And you know, I always say, you know, I want my mum there. My mum is still a part of all my appointments, all my meetings, everything, but it's me that make the decisions, and I value that autonomy and the fact that I'm respected for what I say. Because I think in paediatrics, they don't always take the young person seriously, because they think, well, the parent's got the overriding decision, but actually I'm a big believer in you should involve children from as early as possible in their care and in their decisions, because then for me, I didn't get involved in my decisions, then I got to transition to adulthood and it was a sudden, leap into the unknown for me. But again, I've still got my mum with me, but it's me that makes all the decisions and I'm respected for that. And actually I'm listened to, and actually what I say is valued.
Do you think are there professionals that have the skills and the knowledge, in the event that, that it shouldn't always be you having to advocate for your care, that actually sometimes you have to trust the professionals to. Do you think that there is that connection between the health and the social care system, that it's joined up enough, and that you've got professionals that can also meet your wishes, even if you're not the person advocating for them all the time?
I mean, there is a big disconnect, I will say, between health and social, and even down to between inpatient and outpatient treatment. So actually it's quite hard to get a seamless transition between all these different places, but I think things are joined up better than they were perhaps when I first transitioned in 2011, but it is hard, and I think I've got my mum can advocate for me if I can't speak for myself, and that is really important. But actually my professionals are very good at stepping up to that role. They know what I want, they know what my life wishes are, what I want to do with my life. And actually I go to my appointments with other professionals and they'll say to me, what do you want out of this appointment? And I'll say my part, and they'll say, well, we want this out of this appointment, and then we sit there and we work out how can we achieve all of these goals. And it's a team effort, so actually they understand me implicitly. But also the hospice, my hospice nurse has always been a fantastic advocate. She's come to meetings, she's liaised on my behalf. So actually I've got me as a first port of call, my mum, the hospice, but any of my professionals really are fantastic at being that advocate when they need to be.
If there could be one thing that could be improved for you, or from your experience that would make a difference to other people as well, if there's something that the government could do, what would that be?
I would say make funding less of a postcode lottery, because it really is who you live, who you are, where you live, what you have in that area. I mean, I'm very fortunate we have the young adult hospice. They're a hospice at home service, so we have that support. But actually, we didn't find out about that through the professionals. We found about that through Googling. And actually, there's no kind of communication, but also it's just that postcode lottery. My CCG don't fund the hospice. They never have done. So they've always had to do my care for free. But obviously, that's not sustainable. And the hospice are the CCG are quite happy for the hospice to step up when I need them, but they're not happy to then fund them for what they give. So it's a postcode lottery.
Do you get any social care funding through the local authority?
No, I'm fully health funded, so under continuing health care, so it's all NHS funding.
Okay.
But yeah, they're not interested in funding it. I think someone saw it as it's a bit expensive for what it is, I think was her words, and I don't think they understand really what that hospice is. It's not just the hands-on care, it's that liaising, that advocating, that support, having someone at the end of the phone 24/7 that you can talk to, having that backup. If we're in a crisis situation, we can phone the hospice and someone will talk us through it, they'll make phone calls, they'll do this, they'll do that. So we've always got that backup, because otherwise it's home or hospital, but actually we've got home, hospice or hospital, and the hospice haven't got a building, they're our backup plan.
So do you have a particular professional that coordinates your care?
This is always an issue. I see one of my consultants as my main consultant, but actually they don't do a lot of organising, so I don't have a key worker. The hospice used to fill that role, but as they've got busier and obviously the funding and situations, they can't be to the same degree as they were when I was 17 and they were smaller. So actually it is us, it is us that's coordinating everything, and I think it's exhausting, actually.
And did you have, when you were a child in the paediatric department, did you have the specific person coordinating your care then?
Not really either, actually. We didn't. I mean, I had my general paediatrician, but no one really coordinated the care. That was down to my mum. And we did have the district nurses, and we had a social worker. But again, it was all this fragmented kind of support. So they'd do so much, but not do everything. So actually, we've never had a named key worker that can coordinate my care. It's always been myself or my mum.
I have to say, I find that, I'm a paediatrician. as someone who did research in this, like more than a decade ago, it really is disappointing to hear that you haven't felt that you've had a single, usually consultant, in charge of coordinating all of that. And certainly, I don't know whereabouts in the country that you live, but in some areas that's clearly happening, and in some areas it's not, and it should be happening everywhere.
Yeah, and I mean, I've got a fantastic team, but it's us that's going between them. When I go to an appointment, I take letters from everyone else because you can't rely on them being sent to them. It's just exhausting. It's constant support. It's constant fighting.
You're clearly a very able individual with a very strong family.
Yeah.
And not everybody is in that situation.
No, I feel very lucky to have that support.
Yeah.
I'm quite interested as well in the experience that you had transitioning between being a child and an adult in health terms, and how that, you said it was a really difficult time, and obviously it's a difficult time in many ways, but for you obviously it was a particular challenge in terms of your requirements. I'd be interested to hear a bit more about that, but also what could be done to make that transition better.
So I basically went to see my paediatrician the week of my 16th birthday, and he said, I'm discharging you. So I had no adult team, no adult consultant, nothing to move on to. And I was on tube feeding, I was quite medically unstable at the time as well, so I literally had nothing. So we went from having the children's ward, having the paediatrician, and having this kind of network around us of paediatric professionals, to then nothing. I had a district nurse follow on, that was into the adult services, but I had no consultant to oversee my care. So actually we fought for the first 18 months to 2 years to get a team of consultants, and that was us looking it up, finding out, asking our GP for a referral, and there just wasn't any continuity. And another thing for me is I went from one admission, I was on a children's ward. My mum was allowed to stay with me 24/7, the very different ethos in children's services, and then the next admission I was on an adult ward with 5 dementia patients. There was no TV, there was no distraction, no internet signal, no nothing. And as a 17-year-old that had never experienced an adult ward before, it was terrifying. And actually I found the staff didn't understand why I wasn't just a little adult, if that makes sense. I was a young adult, but they just thought I was the same as everyone else. And actually I needed support, and it was the first time I was making life or death decisions on my own. And that was, it was terrifying, and my mum wasn't allowed to be there except in visiting time, so I was completely alone, making decisions on my own without that support and without that understanding. No one cut me any slack if I wasn't sure, no one kind of treated me with any, not to say he wanted to mollycoddle me, but just to be more gentle, more supportive, to actually say, do you need someone to sit with us, sit with you, Lucy, while there's a consultant here, or do you want your mum to come in and sit with you while there's a consultant here? There was none of that.
And if that was something that you thought would happen, what sort of age do you think that should happen to? Because young people are, we hear on the news that in the one respect they want to be treated as adults earlier.
Yes.
And in the other respect they want to be allowed to have different types of support for longer.
Yes.
What do you think the rights? We don't. There's safeguarding that exists in adults and children's wards. But what do you think the right sort of age frame would be?
I mean, kind of 16 to 19, but I think, in other countries, some children's wards stay up to 25. And I think sometimes having that option would be nice, but I think the biggest thing for me is not necessarily the age of when someone transitions, but when they're ready, developmentally appropriate, when they've been supported, when they've had that education. So, from age 12, 13, involving them in their care, teaching them about their condition, helping them to make decisions, maybe seeing a professional on their own for once. And actually it's that it's not necessarily the actual age, but the actual amount of preparation they've had, and their developmentally appropriate age actually is really important. Because I was bright, articulate, but was not ready, because I hadn't been prepared. And if I'd been prepared, it would have been far, far less scary.
And that was 7 years ago now.
Yeah, that was 2011. I was 17.
This was an area of medicine that's changed a lot recently, so hopefully we'll find that 19-year-olds of today have had a better.
Yes.
So, Ramsey, thank you for your time and your honesty and your bravery in coming in today to talk about what is no doubt an incredibly difficult thing to talk about. Thank you.
Thank you.
You've been listening to Children's Palliative Care Voices, a podcast series from Together for Short Lives, the leading UK charity that speaks out for all children and young people who are expected to have short lives. Together with everyone who provides care and support to these children and families, we're here to help them have as fulfilling lives as possible and the very best care at end of life. We can't change the diagnosis, but we can help children and families make the most of their time together. If you'd like to know more about Together for Short Lives or how you can support our vital work, please visit our website at www.togetherforshortlives.org.uk.